Hi everyone, this is Dr. Priyadatt Patel, your go-to gynecologist from Balaji Horizon Women's Hospital, Ahmedabad. Since long we were talking about endometriosis and laparoscopy and endometriosis. What is endometriosis? What are the symptoms, signs, how the couples are suffering from endometriosis? Laparoscopic surgery, it's important, what needs to be done, when to done. So lot of discussion is going on with us also and in your surrounding also regarding the endometriosis and laparoscopic surgery. So the question to you is laparoscopic surgery the answer for endometriosis? Should all the patient diagnosed with endometriosis has to proceed for laparoscopic surgery? If yes, then why? And if no, then also why not? So first let's understand the presentation of the endometriosis in couples. So of course, very few medications in the world right now which are kind of classified for the at least you consider during the treatment of endometriosis. But the purpose of that medicines whatsoever we are using in cases of endometriosis is not to cure the disease. No medicine in the world at present which is available which can claim to cure the endometriosis. So to cure the endometriosis, of course, the gold standard till today along with diagnosis is the laparoscopy. But laparoscopy for endometriosis has its own perks. Also, you have to understand that why we are doing a laparoscopic surgery for endometriosis, right? Because the indication makes a huge impact as far as the outcome is concerned. So you have to understand that mainly in our practice, we are doing laparoscopic surgery for endometriosis for three reasons. One is pain, whatsoever the type with endometriosis. Second is fertility issues. And the third is organ compromisation. These are the most common indications in our practice where we are doing a laparoscopic surgery for endometriosis. So yes, first of all, everybody should know that laparoscopy still having a gold standard for the treatment of endometriosis is not in all the patients diagnosed with endometriosis. To a certain extent, majority of the patient may require laparoscopic surgery during their lifetime if they have a endometriosis. But we cannot submit all the patient to go for laparoscopic surgery because we have to see the benefit to the possible risk related to the laparoscopic surgery in cases of endometriosis. And mainly you have to see that whenever we do a laparoscopic surgery for endometriosis, mainly it's of two types. One is conservative surgery and the second is radical surgery. Radical endometriosis surgery, when the patient has completed the family life, there is no future fertility requirement or requirement of conservations of the uterus or ovaries, the decision is comparatively easier. Let's do the surgeries, give the maximum possible symptomatic relief to the patient, mainly pain or period irregularities, and cleared majority of the disease from the wherever it is possible to give a best possible outcome for that couple, particularly patient, and reducing the maximum possible recurrence rate. Almost near zero. We cannot see absolutely zero, but near zero. But you have to understand, when we are doing a laparoscopic surgery in a conservative way, like conserving the uterus and both sides of the ovaries, irrespective of indication, whether for pain or fertility, the timing of that surgery and future fertility course is very important, absolutely important. You have to understand that because it may play a huge role in future fertility or recurrence. So let's put it in another way. If we say one of the couple came to the consultation with possible pain during intercourse or pain during the menstruation, and incidentally they found out that they'll have a endometrioma, size is around 2.5 centimeter on a right ovary, little bit stuck to the uterus. Should they go for laparoscopic surgery immediately if they are not planning for pregnancy? Should they go for laparoscopic surgery immediately if they are planning for pregnancy? Should they opt for a kind of ART directly before even proceeding for the laparoscopic surgery? Should they go for a fertility preservation and after that they will proceed for the laparoscopic surgery? So these are the questions you have to understand and you have to ask to your consultant also, and based on that questions, based on the kind of acceptability of the couple, their future requirement and targets, we should provide them a best possible tailor-made approach. Why? Because one thing you have to understand, that one of the most significant impact of laparoscopic surgery when we are doing it for endometriosis, particularly with the endometrioma or chocolate cyst, is compromising of the ovarian reserve. Whatsoever the best possible surgeon we are, whatsoever the very good skill and instrumentation and technology we have, you have to understand that when we remove the endometriotic wall, cyst wall of the chocolate cyst, per se it is a part of a normal ovarian volume. So in a nutshell, we are removing the ovarian volume or ovarian tissue only. So yes, it is going to compromise the ovarian reserve. That compromisation will be based on lots of factors, huge number of factors. But you have to understand that this can happen to anyone. If we not do a laparoscopic surgery, then also, this can happen due to chocolate cyst per se, because its own nature to destroy the normal ovarian tissue. So you have to balance out of conservative management to a radical management. And in that, the present sonographic finding, previous fertility issues, future fertility requirement of the couple has to play a role. Sometimes what happens is we are removing the ovarian cyst because we are doing the surgery for severe pain. It may, kind of produces a severe compromisation of the ovary, reduces the AMH like anything. So that can happen because it's a part of a procedure per se. But you have to remain in contact with your healthcare provider based on your requirement. Timing is very essential to do a laparoscopic surgery. If the size are less than 5 centimeter and pain is the primary concern, you have to, kind of discuss the fertility preservation option with the patient also. Of course, it's a costly affair. Future outcome, we don't know how is it, how much benefit couple will get, but it's feasible basically. Yes, you cannot discuss fertility preservation in the science when the size of the chocolate cyst is more than like 15 centimeter, 20 centimeter, frozen pelvis, colorectal nodule, because in that, if you go for a fertility preservation treatment, you might puncture some endometriotic nodule, introduce the infection, and we are seeing in OPD and even in the surgery of patients with ovarian abscess or peritoneal abscess after the ART procedures in cases of endometriosis. So it's kind of, we can say that it's not always one size fit for all. It's always going to be a tailor-made approach. And this understanding is very important, because the more you understand, the more you discuss your requirement, the more you understand the problems related to it, you will balance out the situation whether you will go for laparoscopic surgery or you should wait for few months and then go for the laparoscopic surgery. Or if you're planning for fertility and you have fertility problem, should you try for natural conception or should you directly go for the ART after the laparoscopic surgery? So lots of question has to be answered. It's not always like, if we have appendix issues like rupture appendix or appendicitis, you go for laparoscopic surgery, remove the appendix, and the game is over, right? So as far as the radical laparoscopic surgery is concerned for endometriosis, the decision per se for us as a healthcare provider, as a laparoscopic surgeon for endometriosis, and for a couple also or for a patient also, it's comparatively easy to understand and decision will be kind of easier to take. But for a conservative approach, when incomplete family is there or future fertility desire is there are a lot of unanswered questions which are there. So you have to understand these questions, you have to kind of discuss it with your healthcare provider, you have to understand the situation of yourself, your sonographic findings, your disease involvement and extent and stages and severity of the disease, and per se your symptomatology. Along with that, your future requirements, particularly fertility requirements, that is also you have to discuss with your healthcare provider. If you have any concern or queries regarding this, you can contact your healthcare provider or contact us soon. Thank you so much. This is Dr. Priyadatt Patel, your go-to gynecologist from Balaji Horizon Women's Hospital, Ahmedabad. Thank you so much.